So hello, welcome back to my YouTube channel. Thank you for following me. Thank you for watching. Thank you for subscribing. Subscribe if you haven't. So today I intended to do infertility, but due to demand, I decided to start with menopause. It's going to be a two-part series. This is part one of menopause, and there'll be part two of menopause. Part one of menopause is mostly going to be on this what menopause is, the signs and symptoms, and what brings about menopause and the factors that contribute to menopause age and harshness of the symptoms that come with menopause. And so before I start, I want to just give a short story or a short experience. So we have many patients who come to us at the age of late 40s, early 50s, complaining. They mostly go to their physicians, general physicians, family physicians, not to their gynecologist, complaining of sudden onset of illness, depression, anxiety, drenching in sweat, hot flashes. And so they don't really describe it as hot flashes, but they mostly describe it as fevers and chills and so many things. So they always, a rapid heartbeat. So they always go complaining to their physicians and they're sick and they need to be investigated. And most of the times they're just counseled and assured that it's menopause and it's a phase and a transition in life. Yeah. So what is menopause? So menopause is a point in time, one whole year after complete cessation of menses. After complete cessation of menses. So if you are a woman with regular cycles, otherwise not affected by anything, and you've had some irregularities towards the end, then the menses just end and they stay for over 1 year without ever coming back. So I think we will safely describe you as being in menopause. And when does it happen? So the average age is 51.5 years. This is average. So it can be earlier or later. It can be a few years before 51 or a few years after 51. And if it happens before 40, then we call that premature ovarian failure, and it has to be investigated to rule out the cause. And so we've seen women who go to their gynecologist with irregular menses towards their late 40s, early 50s, and then they're told that they're in their perimenopause or climacteric age or menstrual transition phase. So what is this? So this is an age a few years before menopause, late 40s, could be 4 to 7 years before menopause, where a woman would mostly have menstrual irregularities that continues until now they get into menopause. So until 1 year after complete cessation of menses. So this is perimenopause, climacteric, menstrual transition, right? And I'm going to discuss why all this happens. So what are the factors that influence what age you'll get into menopause? So because I said the average age is 51, so what if you get it at 47? What if you get it at 53? So the factors include things. The most important factor is genetics. So depending on the age that your mother, your sisters, your auntie, your grandmother got their menses, the chances are that you could get, not menses, but got into menopause, chances are that you'll get into menopause around that time. Another thing is environmental exposures, things and lifestyle. Things like cigarette smoking could bring back menopause by a whole 2 years. Then surgical factors. So if, for example, you've had complete removal of ovaries, then definitely you'll jump into menopause abruptly. Or if you have had any ovary that, any surgery that involved touching or tampering with your ovary, then it will lead you into an earlier menopause. And if you go through drugs or treatment modalities that could affect your ovaries, things like chemotherapy, radiotherapy, then yes, then you could get into menopause a bit earlier. And poor diet, poor exercise habits, obesity could all affect your menopausal age. They could bring your menopause to be a bit earlier than usual. So what happens? What causes menopause? So towards your later reproductive years, the late 40s, the early 50s, we normally have what you call ovarian aging. So there's depletion of ovarian follicles, you know, the eggs and the coverings. There's usually depletion, and this affects completely the signals from the brain to the ovaries that are sent every month to produce egg. So if you're getting into your late reproductive age years, like late 40s, then you tend to deplete your follicles. Then this affects the signals that are sent from the brain to the ovary and the functions of the ovary that is mediated through these signals. So you'll tend to see gradual depletion of egg production, right, of ovulation to a complete cessation. So that's why you will not be able to give birth after a certain age. Then secondly, there will be a decreased production of estrogen and progesterone, and these are the most important hormones in a woman's reproductive functions. So I didn't want to go into so much depth and science of it. I wanted to simplify it, that what catapults it is the depletion in the egg production, affecting the signals from the brain to the ovary to produce estrogen. So there will be no estrogen, no egg production, no estrogen, no progesterone. And most importantly, the lack of estrogen is what causes the symptoms of menopause. Right. Then another thing that happens, other than the usual female reproductive hormones, is that there will also be a drop in what you call the steroids, or the adrenal steroid levels. These are the hormones that resemble the male hormones that function like testosterone. So there will be cessation of these steroid hormones that resemble testosterone, and we'll see the effects of all this in the symptoms. So let's jump straight into the signs and symptoms. So first of all, there will be menstrual irregularity or menstrual disturbances towards menopause. So what happens is that towards menopause, there's depletion of the follicles, depletion of the eggs quantity, what you call anovulatory cycles. So you will be having, and most of the times you'll be having shorter cycles, but you will perceive them as being longer cycles. So you'll be getting your menses, like chances are that you'll be getting your menses after like 60 days, 90 days. So what happens is that it's just an amalgamation of like 2-3 cycles together, and then you bleed towards the end of the third cycles. So the cycles become fine and wide, and you don't really ovulate, right? So you're not really ovulating, or you ovulate far in, you have many anovulatory cycles and a few cycles where you ovulate. So a few ovulatory cycles far in between. So can you get pregnant? Yes, you can get pregnant. Is there an increased chance of you getting twins? Yes, there is. Surprisingly, because the signals from the head to the ovary are usually like double, so there's increase in a hormone called FSH. So if it tells us that if you ovulate, you might end up getting a multiple pregnancy. Yeah, but mostly the chances of conceiving are usually very minimal because the ovulatory cycles are far in between. And then as a result of this, you can go for months without bleeding, and then once you bleed heavily. So there will be menstrual disturbances. So once you're not ovulating, there's something called what you call unopposed estrogen levels. So you end up getting not bleeding for so long, and this unopposed estrogen causes an irregularity or thickening of the endometrium, causing you to have a breakthrough bleeding that can last for days. Then number 2 is that there's there's an effect in the central thermoregulation. So thermoregulation, so as a result of this, you'll end up getting hot flashes, you'll end up getting night sweats, you'll end up getting drenching in sweats at night. Yeah, and the hot flashes can begin 2 years to menopause, and this is caused by the hormonal changes in menopause that cause a dysregulation in the thermoregulator in the brain, the thermostat in the brain. So for some women, they can have hot flashes. They begin 2 years to menopause, and for some women, they can last for only 1 year. That is 85% of the women. In 50% of the women, it can last for 2 years, for up to 5 years, sorry. And then for 15% of the patient, a majority, a big number, not really a majority, but a significant number nonetheless, it will last for more than 15 years. So what are hot flashes? So hot flashes are really heat waves that last for 1 to 5 minutes. They cause an increase in skin temperature and flushing, really. So if you're light skinned, you'll get your skin, especially on the upper body, being very red. So because of the vasodilatation, that is the increase in the girth of blood vessels, to, this increased in the caliber of the diameter of the blood vessels to increase blood supply. So there's usually a sudden heat wave that sweeps over your body, and the heat is usually worse in between the fingers and in between the toes. And the sudden heat will be felt mostly on the upper body and on the face. So it can cause sudden sweating, lasts for 1 to 5 minutes, and it causes at that particular point you have an increased heart rate. Then you can have an increased blood pressure at that point. You can have anxiety, depression. You can have a panic attack at that point. And then afterwards, after that, 5 to 9 minutes after the onset of the hot flash, there will be a drop in temperature due to the sudden loss of heat in the body that was caused by you sweating and the blood vessels being all big and increasing blood supply to the surface of the skin. So this will cause you to suddenly feel very cold. So some women actually experience chills, and then skin temperature returns to normal in around 30 minutes to 90 minutes. Actually 30 to 60 minutes. So this happens due to dysfunction in the thermoregulatory center in the brain because of the hormonal changes that occur in menopause. With menopause, you tend to have a weakening of bones. So there's an effect on bone structure and metabolism. So there's usually an accelerated bone loss that is usually like around 2 to 5% decrease in bone density per year for the first 5 years of menopause. And this could lead to a risk of very weak bones, what you call osteoporosis. And the effect is more if you've started your menopause when you already have weak bones. And secondly, if you have an accelerated rate of bone loss, which varies, it can vary from person to person due to many other factors, such as other diseases that the person could be having, family history, other drugs that the person could be taking. Again, the risk factors for increased bone loss or worsening bone loss is, again, age. If you're above 65 years old, family history of osteoporosis, if you are using other drugs that could cause you to have weaker bones, if you had an early menopause, if you are a smoker, and so many other factors such as excessive alcohol intake, excessive coffee intake, if you have extremities of BMI, very high BMI or very low BMI, so that is overweight or underweight. Then number 3, so another symptom of menopause is that you could be at risk of cardiovascular disease. So that's why many people are diagnosed with things like hypertension during menopause. Because at this point, if you're at risk, the risk worsens. If you're already at risk of hypertension, the risk will worsen with menopause. So the decreased estrogen will cause a decrease in the good fat in the body, which you call HDL. It will lead you to be at a risk of developing all these cardiac is heart and blood vessel issues, so blood pressure, cardiac disease, etc. And then number 4 is that menopause, again, with the decreased estrogen, we say the deprivation or the loss of estrogen in menopause is what causes most of the symptoms. So number 4 is that you could be at a risk of